Coppinger. There's many health issues that are neglected in this country and in society in general, mental health, etc. But I have to say I've been absolutely shocked reading the accounts and the emails from many women following the briefing organised by Deputy Gino Kenny. And I have to say as well, there is a pattern with women's health. There's a nobility in suffering, and the long-suffering woman as a motif in our history and religion is very strong. But it is not acceptable that people would live with chronic, debilitating pain, that they would be dismissed by their doctors, that they would be failed to be diagnosed for several years, and then they would be sent abroad for their health care. Something many women said would not happen after repeal and is still happening, and yet 155,000 women are suffering this, many going to Britain or even Romania. Now, let's be absolutely clear, we are dealing with a gender bias in medicine. The type of medical misogyny that we saw with cervical cancer is many patterns here. And what we need is a centre of excellence to now be established, to diagnose women at a very early stage, not to be dismissed as just having period pain, and then to get the treatment that they need at a very early stage. And I'd ask you to do that, Minister.
Thanks, Les. 1 minute. And I'd like to warmly congratulate my colleague, Deputy Gino Kenny, for hosting the recent briefing. Young women who'd been treated appallingly by our health system over the years in diagnosing and treating this debilitating disease. And as Deputy Kenny said, 1 in 10 women suffer from endometriosis. There are around 155,000 women in Ireland with the condition, and of course the average time for diagnosis is around an astonishing 9 years. And I agree with Deputy Coppinger. This again shows us the fundamental issue around women's health outcomes and the gender bias in medicine generally. The chair of the Endo Association, of course, Ms Kathleen King, told us Irish women are having more ineffectual surgeries than their counterparts, sometimes up to 20 surgeries, and because of lack of specialists in the area. And of course the association and the women affected want much greater education and awareness around the disease and around menstruation in general. Young girls need to know that severe menstrual cramps are not normal, and that medics need to investigate these issues fully, rather than, for example, putting young girls on the contraceptive pill for years when the real cause of pain isn't discovered until infertility issues start later in life. Thanks, Les Can.
1 minute.
Thank you very much, Lascan Corla. Minister, endometriosis is a condition unknown to most people, but those suffering from this chronic inflammatory condition know it all too well. Its debilitating impact on their quality of life. Women live with pain, fatigue and risks to fertility, and they also experience challenges to maintaining good mental health. In fact, the Endometriosis Association of Ireland puts a figure of 1 in 10 women experiencing the condition. I want to compliment this small charity for their work in offering support for women and their families, and also for highlighting this condition, a true example of patient activism. They've told us that those living with endometriosis face significant challenges, such as access to effective healthcare, timely diagnosis, poor public awareness, and difficulties in the workplace. Developing patient-centred care is crucial for sufferers of this condition. Minister, I have a lot more that I could be saying on this, but I hope that you will take consideration of the concerns raised here this afternoon and bring it back to the Minister for Health, including the establishment of a centre of excellence to deal with this disease.
Finally, Deputy Matty McGrath.
Well, hi to you, Minister. I'm delighted to be joining my colleagues on this issue. Minister, I've been contacted by a number of constituents who are suffering from this debilitating and chronic condition, including Aoife Halley, Rachel Ball and Amy Brown. All of these ladies have asked for our support. They are deeply frustrated at the fact, although their lives have fallen apart thanks to endometriosis, they feel they are hitting a brick wall when it comes to this government and access to pain relief. That's shocking, Minister. They feel unheard and they feel uncared for. The briefing last week, and thanks to Deputy Kenny, the AV room, was deeply moving. It was full of bravery. One of those ladies, Amy Brown, contacted me again today with further details about the consultant who performed incorrect and incomplete surgery on her, with the direct result that her life has been changed beyond all recognition. It is a scandal that these people, these women, this lady, young lady, have to go to such lengths to get appropriate treatment and support. And I'm looking for an absolute and categoric assurances, Minister. these ladies have raised, that they will be addressed without further delay and further embarrassment. It's a shocking state of affairs.
Minister Daly has 4 minutes.
And I would like to thank each of the deputies for raising this important matter here today and bringing it to the attention of the House. I understand that it is within the scope of a general gynaecologist to diagnose and treat the majority of cases of endometriosis. Therefore, a GP referral to a gynaecologist is a standard pathway of care for the management of endometriosis in Ireland. This is similar to the pathway in place for the management of other gynecological conditions. Information provided by the HSE indicates that endometriosis can be a difficult condition to diagnose and treat because of the variation of presentations, which can affect the physical and indeed the mental well-being of patients to varying degrees. Treatment may include pain medications, hormone treatment and surgical interventions. The length of time it takes to diagnose endometriosis varies from patient to patient because of varying and sometimes ambiguous symptom presentation. However, the Minister is assured that the provision of training in the management and diagnosis of endometriosis forms an integral part of the specialist medical training programme provided by the Institute of Obstetricians and Gynaecologists. The HSE National Women and Infants Health Programme has advised that the best way to help the majority of patients with endometriosis is to improve access to gynaecology services. As such, the programme has developed a plan to increase capacity and reduce waiting times for women awaiting general gynaecology, which includes patients with endometriosis. The plan aims to reorientate general gynaecology services to an ambulatory or see and treat model rather than the traditional outpatient referral model. An ambulatory care model is a more efficient and effective use of resources. It is also better for the patient as it reduces the requirement for multiple outpatient appointments. The programme will progress this plan in 2020. It is also worth noting that a new Women's Health Task Force was established in the Department of Health in September 2019. The purpose of the task force is to improve women's health outcomes and women's experiences of healthcare. The task force is at an early stage of its work and is considering the full range of issues affecting women's health in Ireland. The task force will tackle a wide range of issues impacting women's health outcomes in Ireland and will work on these on a phased, prioritised basis. Each week, external experts in the area of women's health meet with members of the task force in the Department of Health to inform its work. This initiative has been underway since the task force was established. I understand that the Endometriosis Association of Ireland recently presented to members of the task force, highlighting this important issue which affects many women in Ireland. This issue will be considered by the task force alongside a range of other issues affecting women's health. Priority action areas will be decided by the task force in consultation with stakeholders, including the public. The first action of the task force will be to initiate a national listening exercise inviting women in Ireland to share their experiences of and solutions for the health system, and this will commence in early 2020. More information on the task force is available on the Department of Health website. Margaret.
Thank you, Minister. There are 5 TDs, a half a minute each. Deputy Kelly.
Thanks, Minister. I think it's to be welcomed that under the Women's Health Task Force that endometriosis will be reviewed and so forth. But I think most women that are looking at this debate tonight will say, why has it taken so long to address this issue? I think there's a paternal kind of narrative in healthcare, and over the last, I think particularly in the last 2 or 3 years, we have seen women being let down completely, not only by the Irish health system, but society as a whole. And I think if we could do anything as legislators or as TDs and hold their solidarity out to our kind of sisters today, is to kind of say, look, we'll do as much as we can as TDs and try to put this on the national agenda.
Okay, Minister, you seem to be saying that it's very difficult to diagnose and somehow that was an excuse. Lots of things are very difficult to diagnose. Lots of illnesses take a long time. You know, you can misdiagnose many things. It's not that difficult to diagnose in New Zealand and Australia. It's much quicker to diagnose. Let's be honest here. It's been an ongoing neglect of women's health in this country, which is a particularly backward country where the Catholic Church has dominated for many years. And what you're saying is wait for the task force. But it's not good enough because women aren't waiting any longer. We saw that with repeal. We saw it with the gender quake that's taken place. And I very just quickly ask you, will you meet these women? Will you meet their group and their representative association? There's 155,000 people suffering, not 10 or 12.
Deputy,
and we need a task force set up.
Deputy Bruin.
Thanks. Thanks, Cathaoirleach. Well, Minister, as you know, there are huge delays in waiting to see a gynaecologist. Women may be waiting for up to 2 or 3 years. Like in August, we heard that the Hospital Consultants Association told us that there were 28,000 women then waiting, and 5,400 of whom had waited for over a year. And I asked, obviously in Beaumont Hospital and the RCSI group, what was the number of full-time endometriosis excision specialists about a month ago, and I heard that there were only 2 in that, as far as I can see, in that hospital group. I welcome the point you mentioned about the Women's Health Task Force, but obviously if other countries can have centres of excellence for this appalling condition, surely Ireland can do that as well if you work with the association. Thanks,
I'm trying to be clear, there are 5 TDs. Thank you.
Yeah, I thought we had a minute, Cathaoirleach.
No, I'm afraid a half I've been told.
30 seconds, yeah.
Yeah. I'm told a half a minute. Deputy Corcoran Kennedy.
Thank you. Minister, it has been suggested to me that it takes 9 years to be diagnosed here. I also wanted to highlight the difficulties that some patients are having in obtaining treatment abroad and indeed payment when treatment is obtained. This particularly has been highlighted to me, my sufferer. Also, Minister, can I urge the HSE to work with the Endometriosis Association to devise a public awareness campaign to highlight the condition? I see that they have very informative leaflets available already. Thank you.
I too, Minister, am very unhappy with the reply, because we need to deal with this. We need to take these women out of their suffering, and we need to support the charity that they've set up, an organisation. And I ask you too, Minister, on Minister of Health, will you meet with them and listen to them? Because I too was unaware until I was contacted by these ladies about it. So there needs to be a whole education. It might take 9 years to diagnose. It shouldn't in this country, but unfortunately you're telling us it does. But look, we need to deal sensitively and sensibly and try and understand the pain and suffering that these women are going through, and their families and loved ones.
Thank you very much, Deputy. Minister.
Again, in conclusion, as I mentioned earlier, by improving access to general gynaecology services for the majority of patients with endometriosis can be improved. The HSE's National Women and Infants Health Programme has developed a plan to refocus existing general gynaecology services towards an ambulatory model of care. This, it is anticipated, will not only improve capacity and reduce waiting times for such services, but also provide a better service for women. The programme will progress this plan as a priority in 2020. In addition, the Department of Health is working with the HSE and National Treatment Purchase Fund to develop the Scheduled Care Access Plan 2020, which will include gynaecology services. I did, as I mentioned earlier, welcome the establishment of the Women's Health Task Force, which is working collaboratively to identify key areas where we can work to improve women's health. Women's voices and experiences will be at the heart of the work of the task force. I encourage all interested stakeholders to engage with the listening exercise, which will commence early in the new year. Information and data gathered through this exercise, combined with other available evidence, will form the basis for future policy and action to improve women's health in Ireland. And I will also extend the invitation to meet with the group to the Minister. Pass it on.
Thank you, Minister. Moving on to the second topical issue.